My name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome. This blog post is about something, basic concepts and therapies that are seemingly straightforward, yet don't seem to be discussed in the usual therapies for multiple myeloma. And I'm simply talking about evidence-based, integrative, complementary, or I'll talk at the very end about alternative therapies. But for this blog post, at least where it comes to my own personal life as a myeloma patient, it's about combining the best of conventional FDA-approved therapies, Revlimid, Velcade, daratumumab, those kinds of things, as well as evidence-based integrative or evidence-based complementary. This blog post is simply about trying to define what those are, what is meant by conventional, integrative, and complementary. So, conventional, again, FDA, Food and Drug Administration, researched and approved, oftentimes with specific dose, specific regimen, sometimes singlets, doublets, triplets, one at a time, two at a time, three at a time. The common induction therapy, RVD, Revlimid, Velcade, dexamethasone. Specific doses, specific number 3 weeks on, 1 week off, that kind of thing. It gets more complicated when you start talking about integrative therapies. There are those therapies that, according to research, can enhance the efficacy of a conventional therapy while sometimes reducing toxicity. For myeloma patients, the most studied integrative therapy is curcumin, humans, animals, test tubes. Curcumin, as an example, can kill, it's cytotoxic to myeloma, as well as enhances Velcade. There are others, omega-3 fatty acids, Revlimid, green tea extract. There are a host of integrative therapies. I think the myeloma patient needs the full complement of therapies. Secondarily or thirdly, complementary therapies. Those therapies that complement your conventional therapies. I'm pretty sure if you ask your oncologist, he or she will welcome frequent, moderate exercise, depending on your symptoms, depending on your bone damage, those kinds of things. I'm just talking about a brisk walk every day, maybe a swim. There are those of us who participate in weight-bearing exercises that is shown to strengthen your bones, strengthens your muscles, but muscles pulling on bones strengthens bones. Other complementary therapies, nutrition, acupuncture. There are a host of complementary therapies that enhance, that help your, either when you're undergoing conventional therapy, help them work better, or when you're, let's say, taking a break. You're taking a vacation from conventional therapy, you want to enhance, you want to heal your immune system. Complementary therapies can do that. Nutrition, exercise, no magic here, it's just therapies that are good for you. Last mention, alternative therapies. The challenge with alternative therapies is research. Other than anecdotal evidence, someone saying this therapy worked for me, there's for myeloma therapies, there's little, if anything, that I can find. Maybe you can find something out there. I myself, I want to mention it simply because I myself, after I was told I was end stage, several years of aggressive conventional therapies, end stage, end of the road, I went to Houston, Texas, underwent anti-neoplastin therapy at the Brzezinski Research Institute. Reached complete remission in 17 months. It worked for me. The problem is myeloma is a rare cancer. There's very little evidence, no clinical trials talking about anti-neoplastin therapy and how it affects multiple myeloma. I am anecdotal evidence. I'm mentioning it simply so that you, the patient, know. There's conventional, evidence-based conventional, complementary, integrative, and alternative. Learn the therapies, learn what they mean, learn what they are, build them into your therapy plan. Thank you for your time and effort. Email me with questions, comments. Thank you very much.